Okay, last recording for this lecture, and this one's going to be really short. It's just something you need to be aware of that you might run across at some point in giving care. You are probably familiar with male circumcision, and Ms. Parker will have talked about that. But there are some cultures that practice female genital cutting, and it can range from a small incision on the clitoris all the way to removing most of the vulva with leaving just a small opening for urination and menstruation. So, and there's kind of everything in between. Some cultures remove just part of the clitoral hood. So there's a lot of different options. It is illegal to perform this on minors in the US. There have been some cases where it was being done, but it is illegal to perform in the US. When it's done in a non-sterile environment, there's obviously risk of hemorrhage and bleeding, or hemorrhage and infection, or greater risk of hemorrhage and infection. And so families who want to do this, have this done to their minor daughters may be using out of hospital or out of healthcare resources to do that. So you may see that. Women who have had female genital cutting procedures may have an increased long-term risk of infections, and the more extreme forms contribute to birth complications. So you just need to be aware because you may run into it. All right, that's all for women's reproductive health.